All right, we have hit the top of the hour. So again, thank you so much for joining us, and let's get going. So hello and welcome. My name is Molly Lopez. I am co-director at the Southwest Mental Health Technology Transfer Center, and I will be your moderator for today's session. We really appreciate you joining us for session 2 of this 8-part learning series, MHTTC School Mental Health Curriculum, Always and Now. So we're going to put up a poll for our participants while I go over a few housekeeping items. So please respond to that poll, those questions. We really want to learn more about our audience. So those housekeeping questions: to ensure the best audio quality for the duration of our event, all attendees are going to be muted. But if you do have any audio or technical issues during the session, the chat box is open. Please communicate with our team so they can assist you. If you have a link or resource you'd like to share with other attendees or questions, please enter those into the question and answer pod. We have team members monitoring the Q&A pod as well, and they will ensure that the facilitators receive your questions. To open the Q&A pod, hover your cursor over the Zoom toolbar at the bottom of your window and click on the Q&A function. We have scheduled ample time for Q&A with our guests toward the end of the meeting, but please feel free to enter your questions at any time. We have made every attempt to make today's presentation secure, but if we need to end the presentation unexpectedly, we will follow up using your registration information. You will receive an email following the presentation about how to access your certificate of attendance. The session recording and slide decks will be posted on our website within a few days. Again, a reminder that closed captions are available for today's session. If you prefer those, you can click on the CC button at the bottom, and you can either enable or disable them. And if you don't already, please follow us on social media and stay in touch with us. So again, welcome. If you're new to us, this 8-part series is a collaborative effort of the Mental Health Technology and Transfer Centers, also known as MHTTCs. We are a network funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The MHTTC network includes 10 regional centers, a National American Indian and Alaskan Native Center, a National Hispanic and Latino Center, and a network coordinating office. Our collaborative network supports resource development and dissemination, training and technical assistance, and workforce development for the mental health field. After today's session, we really suggest that you visit our website and find your regional center to keep in touch with us for more resources and training opportunities. We're always eager to hear from folks in our region to learn more about what might be helpful. A quick disclaimer: this presentation was prepared for the MHTTC network under a cooperative agreement from SAMHSA. The opinions expressed in this learning session are the views of our moderator and panelists and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. As part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. So at the end of today's training, we ask that you please take a moment to complete a very brief survey about today's session. The survey should open automatically in the pop-up on your browser window when you close today's webinar. Another quick reminder: as a part of this learning series, we are hosting regional breakout sessions immediately following our panel presentation. These breakout sessions are intended to provide an opportunity for you, our participants, to engage in discussion about the content we'll cover today, to ask questions and share your experiences with other school mental health leaders from your region. At the end of the webinar, we will provide you with a link to access the 30-minute breakout discussion for your particular region, so please stay tuned. Okay, let's get started. So as many of you know, this 8-part training series uses the National School Mental Health Curriculum, Guidance and Best Practices for States, Districts, and Schools. The curriculum was developed by our network in partnership with the National Center for School Mental Health in 2019. It's intended to help states, districts, and schools really advance their comprehensive school mental health and engage in a planning process for implementation. It includes a trainer and participant manual, 8 sets of slide decks for each module representing the core features of a comprehensive school mental health system, as well as additional resources. So today's live session will consist of a discussion with a small panel of education and mental health leaders who will provide really an always and now application to the curriculum. We want to let it be known that the National School Mental Health Curriculum is a great resource to utilize in kind of our normal school settings, but it's also really important in the current context with the COVID-19 pandemic and its impact on the provision of school mental health services. So our panelists will share with us their experience using the curriculum and innovative ideas for really how to implement in our current context. So let's pause a second and look at the results of our poll. All right, so we can see that we do have the majority of our participants who are able to watch the pre-recorded session for teaming today, which is really great. We are excited about that. And we can see in our next question that we really have a range of experiences. Many people consider themselves kind of early in the process of setting up teaming within their comprehensive school mental health system. But we also have a fair number of folks who feel like they're sort of in the middle and they've been doing this for a bit. So I think that's wonderful. That's going to provide some really great context for our panelists, as well as support our discussion as we move into our regional breakouts. For those of you who were not able to get a chance to watch the pre-session video, or if you could just use a refresher, you're in luck. We are excited to have Dr. Sam Reeves with us today to provide a recap of the module and serve as one of our panelists for the second part of our session. So I am excited to introduce Dr. Sam Reeves, and so excited that she is here today. She is a postdoctoral fellow with the National Center for School Mental Health. Those of you who watched the video probably recognize her. She is housed there at the University of Maryland School of Medicine. Her research interests really lie at the intersection of mental health and education, and she often looks at how school and family factors influence student outcomes in underserved communities. She's a clinical community psychologist and really focuses on prevention work and how we can really strengthen those systems that children are in to promote well-being. So we are excited to welcome you, Dr. Reeves, and I'm going to pass over to you for our teaming module.
Hi, everyone. I'm happy to be here and to do a quick recap of the highlights from the second teaming module. So the first one that happened last week was about the foundations of school mental health, and they really went through some of those key components and underlying features of the comprehensive school mental health. And then this one focuses specifically on teaming. And then the next modules that happen throughout February and March will go through the other domains to give you a deep dive and all of the components of school mental health. Next slide. So the module really covers the definition and the values, and then goes through the 10 indicators of teaming practices, and ends with some resources for strategic planning to really focus on being action oriented. And the reason that we talk about this is that school mental health teams are really important, and they are built of school and community stakeholders that are using data to focus their action plans to improve their services and best practices. Next slide. And these can be an array of teams, and they might look different depending on where you are in the country or your geographic region, or whether you're a city or a rural area. But these are some of the names that have been used at schools to describe their mental health teams. And they could be your school climate team or your district mental health leadership team. But likely there are some people who are responsible for making sure your students have mental health supports. And those are examples of teams dedicated to mental health. Next slide. And the reason we do this is because we know that there's benefits in having diverse team members at the table. in that we all bring an expertise and we can collaborate to support our students better if we work together in an interdisciplinary way. So teaming is really important to refine our communication structures and figure out ways that we can collaborate with the people in our school building and sometimes outside of our school building, depending on who is sitting at the table. And it really helps us give a common vision and figure out what we're going to do with the resources that we have so that we can serve the most students in the most efficient way. So teaming is really dedicated to getting your comprehensive school mental health systems organized and on the same page, and that everybody is working towards similar goals. And there's slightly different roles for teams at the district and school level. So our district teams, which I believe are a lot of who is here today, are really important to shaping the policies and practices that are happening at the school level. So deciding what the expectations are for interventions being provided, what data needs to be collected, and the ways school teams are expected to address student needs. They also often are responsible for the training and coaching of school teams. And these may include members such as a director or supervisor of school mental health and behavioral health. Parents and families can be on these teams as well. Supervisors from your community partner agencies. But this is really dedicated to kind of setting the stage and the scope of what happens at the school level and the supports that you give to schools as they are trying to meet the needs of their student population. Next slide. And at the school level, this is like in the trenches, right? They've got to provide the services, they've got to figure out what's going to happen in their building, and they take those policies and practices set by the district and figure out how they can implement them. And also it's a bi-directional relationship too. So they also give feedback to the district about whether or not these policies and practices can be implemented and maybe help refine some of those goals so that everybody can be on the same page and you feel like you can really make movement in these areas. And they're often related because their functions are similar, but they're just at different levels. For example, district mental health teams may examine data and aggregate to understand trends among groups of students, whereas at a school level, you might disaggregate your data to be able to study like individualized plans and figure out where your kids need to move throughout your tiered system. Also, districts might provide the overall funding and coaching and support, whereas at a school level, they are dedicated to the training and the implementation occurring consistently throughout the building. But they're both really important and they work together to create these school mental health teams and support their students. Next slide. So here are the 10 quality indicators that are covered in the teaming module. And I like to think of them as the who at the top. So whether our teams are multidisciplinary, whether or not we have family and community partnerships. And then the middle section is like the what. What are we hoping our teams do? We're hoping that they can address all tiers. We're hoping that there's not a lot of duplication and people feeling frustrated because everybody's working on the same thing and nobody is communicating, and that we have really good structures in place for having these really important meetings. And then those bottom three are like, how are we going to do it? Our teams are going to use data. They're going to use their partnerships to get this work done. So that's generally how I like to think about the 10 best practices. Next slide. And then what the module does after that is goes through each of the best practices and it goes through a deep dive of how you can do this and what resources are available. Next slide. So for example, around teaming, if you were interested in expanding who is at the table, then this might be an exercise that you do with your existing team, asking who's there, who's already doing this work, who else should we bring in? So those might be an exercise that you can do with your existing team if you were interested in expanding who was coming to the table, is one of the resources that is discussed in the online module. Next slide. Another example of a resource available is how do you make an MOU? So the key components of it, and it walks everybody through what you should include, what you want to include, to give you some structure and a template to help you get moving in that area if this is what you decided that you were going to work on for improving your school mental health system. And there's also information on there because we know that sometimes you need data or you need an issue brief or a white paper or something to bring to another meeting with others to show that the teaming is important. So there's also resources in there that really outline the importance of teaming to school mental health. So you can be armed with some data and some resources if you need them for sharing later. And this one is the School Mental Health Quality Guide. And this allows a deep dive into teaming and really expands out the best practices and little small baby steps, action steps that you can take and to improve your system in tiny ways. So it gives lots of examples from the field, really good resources, again, to help you with planning and to make progress on your action goals. And the other thing that is included in each of the modules are helpful tips. So we know that sometimes people listen to these webinars and hear these resources and they're like, ain't gonna happen. So these are some helpful tips scattered throughout the modules to help make movement, to show that it can be done, that these are some of the steps that you can take to make movement on those bigger indicator domains. And then there are some around like how do I work with multidisciplinary teams, and this might be helpful strategies for groups that are a bit more spread out. So we know that some of our rural people from rural areas, there might be less of you and there might be a lot of distance between you and your nearest collaborator. So there might need to be small daily huddles or little debriefs that or take 15 minutes. So figuring out how you can structure your meetings and run your teaming procedures so that they are conducive to your environment. So there's a lot of flexibility in how these teams can be organized and run effectively for your setting. So there's some helpful tips in there about that too. And we know that this can be a difficult one as well, of having clear ways to share data with community partners or even getting information up to your district or state folks if you need to. So there are also some helpful tips around how you can share data. And the other thing that we work in throughout the module are district examples, just to show some highlights where people have tried different procedures around screening and made some improvements. So just a shout out to your colleagues of when this work is really happening on the ground and what it looks like. And then the modules end with strategic planning. So what are the next action steps that you are going to take in this teaming area, and just goes through a process of helping you outline your goals and figure out who needs to be at the table to make those things happen and what are the next steps. So we really want to keep it action oriented. What are our plans for moving forward? And that is a high level overview of what is included in the module. So it goes through why teaming is important, what the best practices are, and likes to give you lots of resources and helpful tips to help in your action planning and moving your teaming best practices forward. And I will shoot it back over to Molly.
Thank you so much, Dr. Reeves. That was wonderful. You covered a lot in a really quick amount of time. We really appreciate you providing us that summary of the teaming module. So now it's time in our program to shift to the next portion of our session, and this is going to be our panel discussion. So I have the privilege of introducing our panel. I invite them to come on camera as well. Thank you so much. So first I have Santoy Trotter, and she is the manager of school-based behavioral health programs at the University of California, San Francisco, I'm not going to do this right, Benioff Children's Hospital in Oakland, California. She has over 20 years of experience providing behavioral health services to adolescents and families, and 15 years of practice in school-based health centers. Ms. Trotter's work is centered in culturally responsive, trauma, and resiliency-informed practices. We're so excited to have you here today. We also have Dr. Lisa Thomas with us today as well. Dr. Thomas is a former elementary teacher and a school psychologist in Pennsylvania. She serves as the assistant director of the Devereaux Center for Effective Schools, where she provides training and consultation to organizations on developing universal, targeted, and intensive behavioral and academic support systems within alternative education and public school settings. So thank you both so much for being here today, and we'll get started.
Thank you, Molly, for that introduction. And thank you, Dr. Reeves, for that overview. Very comprehensive and so useful to set the tone for this conversation. And Molly, I just want to start with my preferred pronouns are she, her, hers, and I'm here in Oakland on Ohlone land. And my current role, as you said, is a program manager for our school-based behavioral health services at UCSF Benioff Children's Hospital, Oakland. And in Oakland and Alameda County, our school mental health teams are called COSS teams. So coordination of services teams, and you'll hear me kind of referring to that. And Alameda County began implementing COSS teams in 2005. In 2006, I first walked onto the campus of Castlemont High School as a new school-based mental health provider clinician. And so I've been sitting and being a part of COSS teams for the past 14, almost 15 years, and have the great honor and privilege to support a team of mental health clinicians at this time. Our school-based behavioral health team, we're located and embedded inside school-based health centers. So I want to kind of give that information as well. And our school-based health centers are either, located on the school campus or right next door to the school campus, and primarily funded and supported through our county's Medi-Cal, which for other people might be Medicare. But Alameda County really partners with organizations and for their mental health services throughout the county. And so that's mostly how we're funded, and some philanthropy. So just want to share that. And, we're in deep partnership with Oakland Unified School District. Majority of our referrals come from teachers, school providers, students themselves. And I'm just really glad to be a part of this conversation and to just share my experience from the cost table and sitting at many cost tables over the past many years. Thank you, and I'll pass it to Lisa, Dr. Thomas.
Hi, thank you so much. Hi everyone, I'm Lisa. My preferred pronouns are she, her, and I truly appreciate the opportunity to connect with you all to discuss my experiences with teaming. I approach my work through a multi-tiered system of supports framework, whether that's in my role serving as one of the state coordinators for Pennsylvania's Positive Behavior Support Network, or through my training and consultation work with different school districts, school teams, and other child serving organizations. Cross-disciplinary teams are an essential part of the MTSS framework, and my role is to help schools build and sustain effective teams at the universal, targeted, and intensive levels of support to improve behavioral and social emotional outcomes for all students served. And I achieve this through training and coaching schools to implement efficient meetings and use data for decision making so that we can have high fidelity teaming practices.
Thank you both so much. Clearly we have the right people here to kind of share with us today, so we so appreciate you being here. We're going to start off with a couple of questions that are kind of mirrors of each other. So tell us a little bit about some of the successes that you've seen happen as a result of really good teaming practices, but also some of the common barriers that schools face, schools that you've either worked with or worked in that they've experienced around teaming. And then how do we do better at that? How do we overcome those barriers?
Thank you, Molly. So many successes that we've witnessed, and I want to start with kind of what helps make a successful school team, and just remembering that relationship is at the foundation of all of our work, and we heal inside a relationship. And so having a COSS or a school behavioral health team that really also centers relationship. So some of the best practices are even things like, having an agenda, but having a check-in as part of that agenda, having our district does optimistic closing, but putting some structure in those mental health teams or school teams to center and build relationship. Also, during this time of COVID-19, our cost teams focus on mental health wellness and well-being, but also have focused on, providing groceries or technology and other needs, and really centering, having all the needs for the students in the school come through our cost team, right? And so whether it's academic or mental health, right now, our team really has after school providers and administrators all at the table. One of our clinicians shared a story from a young person who we have the ability to work with young people in high school and kind of beyond up to age 21. And he was referred to the cost team when he was in high school because he had lost a death of a parent, and grades changed and was having, just difficulty that his teachers noticed, and he got referred to the cost team. And for many of our young people, even understanding grief and loss, and we work in East and West Oakland, many young people have experienced loss of a parent and loss and death in many different ways, but helping that young person understand the experience of grief and loss and have a therapist and center in it, and really supporting around the family and helping the family, extended family, understand their experiences. And now that young person is in college and asked his therapist to share back with the school team kind of his success and how he felt really held by the school and the mental health providers. So that's just one small example. But I think having a universal referral system. So sometimes in schools, you might have many different teams, but really for us, we keep kind of reminding teachers, reminding schools, all the referrals go through cost. And we bring everybody at the table who needs to be there. And then at that place, we bring all the minds and different disciplines together to triage and assess where that referral goes to, what that student needs. I think another success or something that supports the success for cost teams is having administrators be a part of your cost team. So whether it's a principal or vice principal, really engaging leadership as part of your team and helping them it also gives them the chance to understand and know their students and know what some of the challenges their students are having. And one of the things that's happened for us this year as a result of our cost team is principals asking us to go do trainings and presentations for teachers to just help expand teachers' knowledge and awareness and really even build empathy. I mean, we know they have it, but to support kind of a reminder of what students are going through during this time. And that's been helpful. I think one thing that I want to remind us of also in those cost teams is making sure that we're identifying and building upon students' strengths and their resources. It can be sometimes in the cost team because students are referred to cost team or your mental health team because of the problems, right? Whether they're failing their classes or they're acting out, they're beating up on their peers or they're not showing up to class, right? They're referred to the team because of problems. But we know that if a student is in school and they're showing up, that there are resources and strengths that they're drawing upon. And we want to make sure we're speaking to those as well during those cost teams and building upon those strengths. I think I'll just say two other things and then pass it on to Dr. Thomas. I think one thing is also our mental health teams have a wide variety of professionals, and one both strength and barrier to that is really holding that each team professionals have different legal, ethical considerations. And so just making sure that there's conversations about that and understanding around that, and some pre-planning around confidentiality, and that team members may be able to share different amount of information. So holding that. And I think one last success I'll share is our cost team. We had a school that had a death of 2 alumni members in December. And the following year, we knew that the anniversary of those 2 young people was coming up, as well as December is a time that students are going away from school. And it's a holiday time. We know that it's a time where feelings of grief and loss can arise as mental health professionals. And so our cost team worked with students and teachers to have a day of healing before school was out, and that included a security guard who shared a song. And the Day of Healing was asking people, how do you deal with grief? How do you cope? We know that grief and loss is a big part of our community and an experience. And so how can we share with each other how we get through these hard times? And that was coordinated by our cost team, seeing a need. And we had student voice, we had the principal there, we had students sharing poem and teachers, but everyone coming together to share that those resiliency practices and protective practices. One success of our cost team. There are many barriers. Maybe I'll have Dr. Thomas speak, and then I'll speak to some of those.
All right, thank you so much. So many of my successes have stemmed from training and coaching teams to move from problem admiring to precise problem solving. So instead of saying the cafeteria is out of control, I work with teams to support them in reviewing data and developing precise problem statements, such as fifth graders are not lining up when the bell rings, with an average of 4 minutes and 28 seconds delay in transition from the cafeteria to the classroom between 11:45 to 11:50 a.m. in the cafeteria in order to avoid returning to classroom instruction. And by creating a more precise problem statement, we're able to have more effective problem solving, and that helps us to create SMART goals, such as reducing the transition time from the cafeteria to the classroom by 50% by next month's meeting, and then develop meaningful solutions, such as reteaching transition expectations and putting in an interdependent group contingency to encourage peers and students to work together to decrease transition time. And then, of course, we can document all of this on our meeting agenda under our action steps and hold each other accountable for following through on what we agreed upon. And based on this work that I've done to train teams to move from problem admiring to problem solving through developing those precise problem statements, SMART goals, and action plans, we have seen a significant reduction in exclusionary disciplines such as suspension and out-of-school placements. We've seen an increase in student social skills, an increase in the use of proactive strategies by staff, and thus decreasing the need for more students to receive more intensive services, particularly, again, being placed out of school. We've seen an increase in students' access to services, as well as matching those services to students' needs, and also an increase in the use of evidence-based practices. In terms of some of the barriers and solutions that I've seen, I would like to highlight 3 barriers and some potential solutions that come directly from the curriculum we're talking about today. The first barrier I would like to highlight is administrator support. And I did see a comment about administrator support in the chat box. Research by Kent McIntosh from the University of Oregon has found administrator support to be the single greatest enabler and predictor of implementation and sustainability of evidence-based practices. And I truly have found this to be relevant in my work. Administrator support and buy-in directly contributes to the success of teaming. If the administrator does not regularly attend team meetings, does not prioritize the work of the team, sends mixed messages to the team, or when there's turnover in administration, it is very challenging for teams to make progress. As such, it's critical to engage administrators in the teaming process. As a trainer and coach, I work to ensure that administrators understand the teaming process and the type of support that's needed from them to ensure effective teaming and implementation of evidence-based practices. In addition, I support the administrator and team in creating a shared vision and action plan that prioritizes areas for improvement. And in your curriculum, there are some great resources, such as the Multidisciplinary School Mental Health Teams Roles and Functions that includes identifying the administrator as an active team member. And I also appreciated the Leading by Convening blueprint. That is a great resource to share with administrators to help them understand how they can authentically engage stakeholders on teams. The second barrier I would like to highlight is team composition. Too often, teams only consist of administrators that oversee the staff, but don't directly work with the students served. And it's very important to have the right people at the table, meaning the team composition should represent the students being served as well as represent the staff working with those students to ensure the team's discussion and intervention implementation is culturally sensitive and has contextual fit. And again, there's those two great resources I just highlighted for administrators also apply when you're thinking about creating your team composition. So looking at the multidisciplinary school mental health teams roles and functions, and the leading by convening blueprint, which highlights who should be on teams and how can we authentically engage stakeholders, including community members, families, and students. The third and final barrier I would like to highlight is having parallel teams. This often occurs when schools have multiple teams that talk about the same thing, but these teams don't talk to each other. So a school might have a climate team, a behavior team, a PBIS team, a pre-referral team, a student assistance program team, a school mental health team. And we are working harder, not smarter. So what we want to do is encourage our schools to use the school mental health team alignment tool that's included in the curriculum so that you can examine overlap in team membership, the purpose of the teams, the responsibility and goals of the teams. And based on this analysis, the schools are encouraged to align and integrate teams to prevent duplication, assure efficiency in terms of our staff, time, and resources. And now I'm going to turn it back to Santoy.
Thank you, Dr. Thomas. I think one thing that I want to just add in terms of barriers is both barriers and opportunities. So when you have multiple disciplines at the table, one of the things that we can do is make sure that all the referrals don't go for treatment, right, for that tier 3 mental health provider. And that's something that was happening for our team for a while where, you know, everyone gets referred to mental health treatment and therapy. It may be that we need kind of a warm handoff or more need that there's some case management needs, or it may be something that the after school coordinator could do, or the 9th grade team person, family partner, right? And so one of the things that we did is bringing together multiple disciplines at the table, and then really triaging what referrals need to go directly to mental health treatment provider, and making sure we're using those limited spaces for youth who do need treatment, and then using other referrals where there might be another lower level of intervention. And so I want to share that as both a barrier and opportunity. If you have multiple partners at the table, providers at the table, being very clear about who provides what services and what referrals are appropriate for that provider. I think in the worst version, right, there can become kind of competition for referrals and for students kind of at the cost table. And so we really want to be clear about, you know, what does this agency, you know, if you have multiple, if we're lucky enough to have multiple providers at your table, you know, really clear about what the expertise and the scope of the work that each provider provides. And I think holding, you know, I think one other barrier can be kind of gossiping versus problem solving or solution finding or referring. And that's just some, you know, kind of getting kind of deep into the problems of the students and sharing rather than really having kind of more of a, again, holistic and holding the respect and dignity for each student. And this goes back to making sure that we're thinking about the strengths, we're naming those, we're paying attention to the challenges and referring them to need. And that then we're following up on those referrals. We're making sure that someone did get connected to services. And if they didn't, then what's another level or another place to connect with that student? So just wanted to share that. Thank you so much.
Thank you both. So many wonderful pieces of guidance and advice. Very helpful. I'm going to actually move to this question because I know folks are very curious to kind of understand what looks different with teaming now during the pandemic, and how do you see kind of things changing, perhaps even going forward into the future?
I appreciate this question so much. You know, one of the things as a school-based providers, and we think, you know, I think many of us know, you know, we want to bring health care services to students in schools where they're at. And then when schools closed, you know, we all, you know, in March last year, there was a lot of concerns like, what are we going to do? And for me, I had such great confidence in our ability to provide healthcare services to students in schools, because school-based services are both location and partnerships with our schools. That's the two, that's, you know, you can have a therapist in a school and they will never get a, you know, it is the location, you know, and the partnership. And we had the partnership solid and stable. And so for our school-based teams, our cost teams, coordinations and services teams, they met more often. They met throughout the summer for some of our teams. A smaller group continued to meet to identify who are those students who had vulnerabilities, who had mental health vulnerabilities and needed to be connected to services, as well as might have needed connection to groceries or technologies or hotspots. A lot of problem solving around getting technology to students so that they could do virtual learning. I think what we've seen via telehealth is actually for some young people more inconsistent attendance and engaging in mental health services. So we want to remember that you know, telehealth is here to stay. And what I've noticed also for our cost teams, they've become a real support for the adults who are doing this work on campus, you know, and so there's the community has in some ways strengthened during this time. And, you know, we have our check-in questions and we have our, you know, we go over referrals and we make sure those students are getting served, but there is, it's really meeting a need for connection and collaboration that's happening. So I think the pandemic has really been an opportunity for this coordination part of school-based health services to really be as effective as possible and meeting the needs of students. And so I'll pause there.
Some of the changes that I've seen occur due to the pandemic is that meetings have been put on hold, or teams have shifted their focus to more of the immediate need, like ramping teachers up to deliver remote or hybrid instruction, securing PPE for school staff and students, dealing with technology and material distribution, getting food to the students, dealing with concerns related to equity and attendance. And those immediate needs have kind of shifted focus, I think, away from, you know, the action plans that we had in place previously and the kinds of discussion and work we were doing. There's definitely been a much greater emphasis on attendance as our primary challenging behavior. And we've also really struggled with data sources. None of the schools I work with have been doing universal screening data. We're not able to, you know, get the level of direct observation data that we were previously. Schools aren't writing office discipline referrals. So our data sources have decreased significantly, making it harder to engage in that precise problem solving using data-based decision making. Other challenges have been related to the providers, it being very difficult to provide group interventions over video conferencing when you consider confidentiality, the environment not being conducive for group, and also many of our counselors and other providers' comfort level with running virtual groups. So I definitely think that there have been, you know, several challenges. I think my pitch would be to encourage teams to, you know, revisit their purpose and mission of the team and continue with their regular meetings, because the work that we do is so important. And we want to make sure that we are able to support the students and continue to engage in that data-based decision-making discussion and action planning to have that change for our students, to be proactive and preventative to support our students from preventing them from developing significant mental health concerns, but then also be able to mobilize those supports for students who are identified and demonstrating those mental health concerns.
I think, Melly, if I can add just two last things. One is, I think when students are virtual, sometimes students don't have their camera on. And so it's been harder for teachers to refer in some cases. We have been successful in providing group therapies. We're actually running DBT groups virtually via telehealth and learning each time. We're moving into kind of our next version, another iteration. We're starting groups at the beginning of March, but we have successfully run DBT groups virtually. And we're learning, you know, we're learning a lot kind of in this process. I think as we move towards return to the school buildings, what Dr. Thomas is saying in terms of screening. There's so many, yes, CBITS. I see that someone putting in the chat. CBITS is a great modality to address trauma in schools. But that we have ways that we're both providing screening universally for students, as well as building the capacity of educators to build trauma-informed, safe environments inside of their classroom. There's not going to be a therapist for every student who needs it. We'll keep kind of building our fleets of therapists in schools, but we also want to build the capacity by providing consultation to teachers and administrators in schools. So I think that in terms of recommendations going forward, those are some of my recommendations going forward.
Thank you both so much for that. It's very heartening to hear about how those relationships, those really strong relationships that were built through really strong teaming practices have carried through really and allowed those teams to continue during this time in really effective ways to meet student needs as well as staff needs throughout the pandemic. Thank you for that. We want to have an opportunity now to address some of the questions that have come up from our audience. So we thank you so much to our panelists. We're not going to let you leave quite yet. We want to welcome and ask Sam to join us back again, Dr. Reeves again as well. So I'm going to turn the podium over to Nadia Kalinchek, who's going to lead us through some of the questions.
Hi there. Thanks so much. And thank you, Molly. I was just getting all the questions lined up and queued up. So we'll start with Jillian's question. Jillian was asking, how do you recommend best incorporating administration in teaming process?
Sure. I talked about how I feel administrator buy-in and support is critical. So I think it's important to, in my role as a trainer and coach and consultant, to meet with the administrator up front so that they understand what the teaming process is, what their role is, the roles of others, how they can be supporters of the process. Sometimes I provide, a document that they can reference and refer to. I often will meet with the administrator prior to doing a training for the team or staff so that they can feel like they have greater understanding of the content and they can become content experts and champions during a training or meeting with the team or other stakeholders, so that it's not just me as a coach or consultant delivering it, that the administrator has a clear role in the process. So I think it's just very important to build those relationships, as Santoy said, and be very intentional in building those relationships with administrators and carving out those times to meet with them ahead of time and be really clear on what the role is and what you're looking for from their support and how they can best, be engaged in this process, understand what their priorities are, and help be that bridge between the administrator and the team to link the priorities between them.
The only thing I would add to that is, supporting the administrator, that we have the same goals, right? So attendance and academic achievement and graduation, and that attending to the mental health and well-being of students meets those goals. And I think, we have a vice principal at each of our class teams who sits on our student mental health teams every week and is a part of those teams. And so we know that administrators are incredibly busy and it's, how to help them prioritize, but they are able to do it. And I think when you align the goals and really find out who's in charge of social emotional health and well-being, who's, is it that the principal, is that the vice principal, is that someone else kind of in a leadership role at a school, and have that person at your table because you have the same goals. And that coordination really does have you be stronger and more effective in meeting the needs of students and having them in their seat, that seat time, and moving towards graduation.
Thank you, Santoy and Lisa. We had another question from Chad that came in, and he says, I work in a large district. We have established multidisciplinary leadership teams at schools, but there's definitely a feeling that this is just one more thing. where it ends up being a work list for mental health professionals to follow up with students and move on to the next. My question is about how to navigate local control barriers.
I can speak to the piece around it being one more thing. I can't speak to the local control, but I think in terms of it being one more thing, we need to hold that we were, before pre-COVID, we were already in a mental health crisis for adolescents. And that the, number 1 in 4 adolescents kind of have a mental health diagnosis, untreated, undiagnosed. And if we're not addressing, for children and adolescents, their mental health well-being, we are doing a disservice. And that if we come and addressing it in a coordinated, intentional, planned out way is, I think, what Dr. Thomas and kind of we're sharing, that there are ways to do that that makes it an effective use of time. We know that anybody on a school campus, time is precious and there's so many things to do, and we respect, especially for whether it's a teacher or administrator, kind of the preciousness of time. And when we come together, we can actually, it can be less time because we're coordinated and working together.
And to piggyback off of Santoy, this might also be a helpful time to implement some of those best practices or those worksheets or activities around coming up with a mission for your team, taking stock of what teams you have and who is on them. So you can have the information again in front of you of who's on it. Is it really repetitive, or is this a needed central team, and be able to have that information for your local control boards. You can also invite them to be a partner with you on these teams. They can be one of those other folks at the table to help bring them in and get them, everybody on the same page, as a way to kind of communicate and centralize what's going on. But having a mission, having some idea of who and what you're going to do for your teaming practices might be helpful to bring to the table when you're talking to these local control agencies.
Thank you, Sam and Santoy. I believe we have time for one more question, and this is from Matt, and just came in. And our district has widely divergent school vis-a-vis resources and socioeconomic status. COS or similar teams seem to have gotten their best start in schools in which the numbers of students who could benefit from COS teams don't seem so overwhelming. Suggestions for overwhelmed schools at this stage of the journey?
Absolutely. So as I said, I work in East and West Oakland. Most of the students have been impacted by trauma and stress. We have, we're fortunate to have 6 mental health providers at one school. But even with that, our referrals get filled up, our clinicians get filled. There is the overwhelm. And I think that's where the coordination team or the mental health team really helps us come together with school staff, come together with case managers or substance abuse providers, after school providers, to really work together to wrap around the needs of the school, the whole community, and the students, and those students with highest needs, but also, thinking together about preventative efforts or school-wide efforts or universal efforts. So I think, just to speak, the needs are and can be overwhelming. And so I really appreciate you acknowledging that. And I think that I know, and have felt deeply through the coordination through this pandemic. I think it can be hope generating for providers, the amount of effectiveness that we can be as a team. So I just want to speak to that, because it can be, when you're working on your own or even with a mental health team, right? We're talking about kind of, I see in the chat a lot of trauma-informed work, but the effectiveness of the COS team, is what helps me be here 15 years later in school mental health services.
Absolutely. Sam?
I was also going to say, celebrate your small wins, like little changes, little improvements in your system count. We work with a learning collaborative, the COIN, to help improve school mental health in a couple of states that we're working with. And we focus a lot on small tests of change and celebrating those small wins. So I know that it can seem like a big problem and an overwhelming amount of need, but the little things that you do to improve your teaming practices or whatever other domain you want to focus in do count. They are successes in the right direction. Filling out a little form, naming your mission, doing all of that is in service of this larger goal. It may not always feel like it or translate into giant changes in the day-to-day, but it helps and set a really solid foundation for your systems moving forward. So I would say celebrate the small wins as a place to start doing little chests of change and celebrating them.
I hear that hope and healing and that relationship building shining through on all these answers. And we have one more quick, super quick question. And it is from Jenny. We're in a small community. How do you include community mental health providers in the process? So.
I think telehealth has certainly, helped to bridge that gap where it might have been more, challenging previously. Now that we're all, kind of more used to the telehealth approach, I think that that could be a great way to engage those community mental health providers. There's a great tool in the curriculum for developing those memorandums of understanding, which are one of the important first steps to engaging those community providers. But I think, just not being afraid to reach out, have those conversations, and develop areas where you can find your shared areas that you work together and can action plan and support around, I think is a great first step.
Wonderful. Thank you so much. And thank you, panelists, for this question and answer session. I did want to make note that during the question and answer pod and chat box, there has been requests for resources for secondary trauma as well as trauma-informed resources. So we'll be compiling a list, with suggestions from our panelists as well. And we'll be getting that out after the webinar. So be on the lookout for that as well. I'm going to go ahead and turn it back over to Molly Lopez to close us out. Molly?
Thank you, Nadia, and thank you so much to our panelists. So please don't leave us. Coming up next are our regional breakout sessions. So these are those 30-minute opportunities for really diving deeper, asking more questions about the topics that were discussed today and having conversations with participants from across your region. To participate in the breakout sessions, click on the link that is being provided in the chat box, and the link will take you to a document that lists our 10 breakout sessions. So you'll find your region and click for that Zoom link. We really hope you will join us for those discussions. For information about your local, state, and regional school mental health training and technical assistance activities, make sure you reach out to your MHTTC in your region. We'd really love to talk more with you. Also, we want to remind you that this is the second learning session in our 8-session series on the school mental health curriculum, Always and Now. And we have our next session on March 9th. It will be at the same time as today, and we will focus on needs assessment and resource mapping module of the school mental health curriculum. So information on how to register for the remaining sessions will be included in the follow-up email that will be coming your way in the next few days. For those of you who are wondering where you might find that school mental health curriculum, it is available on our website. You will have access to all of those resources that were shared today, and so we hope you will look into that as well.